Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specialising in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Today my guest is Dr. AnnMarie Graziadio from New York, from Apple Valley Pharmacy. Thank you for joining me today, AnnMarie.
Thank you for having me.
Well, first of all, can we find out who you are, what training you've had, where you qualified, all of that kind of thing?
Yes, sure. Okay, so I got my bachelor's degree in pharmacy at Northeastern University in Boston, which is where I lived for 12 years. Right after getting my bachelor's degree, I continued on to receive my doctorate degree in pharmacy from the University of Rhode Island. I did most of my clinical work at Massachusetts General Hospital in Boston. I then moved on and got a job for a pharmaceutical industry position at Solvay Pharmaceuticals, which has now been purchased, so they are no longer a company. But I did receive experience coordinating clinical trials between that company and teaching hospitals such as the Harvard Group, which includes Mass General, among 6 others. Got to travel around the world and attend many conferences, and it was fabulous. Mm-hmm. Then I decided I wanted a family, and I couldn't do that traveling 3 weeks out of the month. So I decided to go back into a clinical role at a hospital. I ended up leaving Massachusetts and coming back to my home state of New York to be closer to family and raise my children here. After doing that, working at some local community hospitals, I found that it wasn't very challenging. Didn't spark my interest very much, just seeing the same kind of patients in and out with nothing very exciting going on. So I ended up getting a job with a local compounding pharmacist. And when he was ready to retire, I purchased that pharmacy, which is now called Apple Valley Pharmacy, and we specialize in non-sterile compounding.
Oh,
so
wow.
We service our local community where I grew up, mm-hmm. But we're also a bedroom community to Manhattan, so we get quite a few patients from that area as well.
Okay. It's always nice to go home, isn't it?
Yes.
Especially if you've got family to help out with child minding.
Yes.
I'm saying that from a grandparent's point of view because I have look after my grandson. My daughter's a nurse, so hours are funny. So it would seem to me as though, you've got this clinical background, research. How have you found compounding LDN and the patients that you supply LDN to?
Oh, it's wonderful. We've actually seen a large increase, I would say, in the last 16 months in prescribers that are familiar with low-dose naltrexone and are using it for a myriad of different treatment modalities. A large base of our treatment, our compounding business, is hormone replacement therapy, and we're finding a lot of crossover between the patients. Mm-hmm. Unlike a woman who is menopausal and frustrated, they're a little bit more of a challenge to counsel and monitor mm-hmm. in some instances, but we're finding the patients that are using low-dose naltrexone have hardly any side effects at all and are just thrilled to find something that works, that isn't interacting with anything or breaking the bank either when it comes to cost. Mm-hmm. So they're a pleasure to work with.
So when you're talking about hormones, etc. People with thyroid conditions usually find that they have to reduce their hormone medication once they've been on LDN. It seems to their normal dose becomes too high. Have you found that with your patients?
We are. And usually the patients that we are treating with LDN that have a thyroid condition are also compounding that thyroid medication as well. They're not using a commercially available product typically. Not everybody, but we see that as well.
And what forms do you compound LDN into?
I would say 99% are capsules.
And what about the filler that you use in the capsules?
Microcrystalline cellulose.
Okay. That seems to be the filler of choice, I think, for most pharmacies. And have any of your patients reported any negative side effects, other than the standard vivid dreams or sleep disturbance?
No.
And that's
been great.
That's one of the good things, isn't it? The plus points. I mean, some people say to me, I'm really worried about taking LDN. What are the side effects? They're so minimal. And when we did a survey a few years back now, we found that only 5% of people had any side effects anyway. And that was back in the days when the standard dosing then was 3 milligrams. After a month, you move up to 4.5. And there were people dropping out. But by having a slow introduction, it would seem, 9 out of 10 people can tolerate LDN by doing it gradually. And it's not always the case of the higher the dose, the better the benefits. It's what dose suits that patient best. Have you noticed the range what would you say the range is that your patients take of LDN?
A lot of our local providers start at 0.5 to 1 milligram and then slowly go up for 30 to 45 days to a maximum of 4.5 milligrams. But I honestly don't think I have anyone on 4.5.
Really? That's amazing, isn't it? Also, when we did this survey, it showed that because people wanted to know if it was, height-weight ratio as to what dose you should be taking. And it would seem the 3 milligrams were mainly taken by men. The 4.5 was normally by women. I mean, we're talking some of these women that were only 5 foot tall, only weighed like 7 stone, and I can't think what that is in pounds off the top of my head. But then you've got the men who are like rugby players, 6'3", broad men, could only take 3. So it was nothing to do with, how heavy you were as to what dose you needed. And in your pharmacy, do you have any children taking LDN, do you know?
We do. They're adolescents.
Okay.
So they're not super young, but
and of course
I have a 16-year-old and a 14-year-old.
They would be able to
currently
take
that I can think of off the top of my head. Yes.
And would you know what conditions those patients are taking LDN for?
I don't know that off of the top of my head. I'm sorry.
That's fine. So what is the feedback that you're getting from your patients?
There's no complaints at all. There's never any issue with other drugs. Obviously the titrating up is when they would normally say if they had any of those symptoms like the vivid dreams and the nightmares. But we've had maybe one person say that they've experienced that during the titration phase, and usually it goes away. So the feedback has been positive. There's no, they're feeling better overall in their condition.
And how many?
And they're needing to use less traditional drug. I'm sorry. Like you were explaining, if someone has a thyroid condition, they're needing to use less of it, a smaller dosage over time.
And we also noticed that people with fibromyalgia, where they were taking, 14 to 20 different medications a day, reduced it to maybe 3 or 4, and some of them were just down to purely taking the LDN and nothing else at all. So that has to be good for your system, doesn't it? not to have to
Absolutely.
clog it up with all these other drugs. I know if you need to take them, you can't do anything about it. But if you read all the side effects that drugs can possibly give you, it's quite scary, isn't it? And once you start adding, the second one, the third one, the fourth one, some people then are having to take another pill of some kind to combat the side effects from the cocktail of drugs they're already taking. And I find that really scary.
Mm-hmm. And it happens every day
Really?
in multiple disease states. Oh, yeah.
So it's a common thing.
It's also, very common in the U.S. anyway, because we don't have centralized medical records. So patients are going to different doctors for different ailments, and no one is communicating to each other. So unless the patient remembers to tell each specialist what the other one has prescribed, a lot of times physicians are prescribing without knowing everything the patient is taking.
Okay. So, which is even scarier, isn't it? Because if there is a contraindication with taking several drugs, if you shouldn't be taking A with B, but the doctor who's prescribed A doesn't know that you're taking B.
Right.
I mean, as a pharmacist, do the patients normally get the prescription and always come to you so that you can say, hang on?
Typically we're the ones who pick it up.
Okay, well, that's good, isn't it? And this is why I think having a one point of contact, if they're always getting their medication from you, even though the doctors don't know, you know what the patient is having and whether, you shouldn't be taking this drug with this other drug. Mm-hmm. So that is a good way of monitoring. Very good way.
And we try when we receive a new patient into our practice, if it is for a compounded medication. I mean, a lot of our patients just come to this pharmacy because we're the only one around that does this. And on occasion, they still want to fill their traditional prescriptions at another pharmacy. And I try to encourage them not to, and not from a financial perspective, but just so that it's all housed in one place. Mm-hmm. If they don't want to do that, then I at least have them ensure that each month we update their medical records so that we know what else they're getting, because that's critical, very critical.
Yeah. So what happens when a patient comes to you for the first time? Do you get them to fill in this medical record?
Yes, we have a whole intake form similar to what a physician's office would use. And even though, whether they fill the other prescriptions with us or not, whether it be an actual prescription that a doctor has to write for, or if it's an over-the-counter vitamin or mineral or herb, all of that has to be addressed. I don't address, it's more integrative. I don't want to just know the one thing you're here for. I need to know everything about you. Otherwise, I won't know if that one prescription that we're compounding would interact with anything else that you're using.
Mm-hmm. And typically, what kind of drugs can't you take together? Or is it so varied?
There's a myriad. Mm-hmm. Yeah, very, very varied. But we're finding that most people that are on the low dose naltrexone in our practice are not coming in on anything else. So that's fabulous.
Wow.
They're just taking this. Mm-hmm. It's very rare that we have them on multiple drugs.
And how long have you been compounding LDN?
I would say 6 or 7 years now.
Mm-hmm. And would you know roughly how many patients you've got taking LDN?
I don't. I should have tallied that before this call.
No problem.
I just know that in the last 16 months, we've noticed a definite increase. Mm. So I'm not sure what that's contributed to. I think it's just some of the physicians in our area are becoming more educated on the benefits. Mm-hmm. That's what I'm attributing it to, but I can't be exactly sure.
Well, I think LDN, it's like a snowball coming down a mountain. It's gathering speed, mm-hmm. It's getting bigger, gathering momentum, and I'm not that big a Facebook fan. I do post all the charity things on Facebook, but it's a way of people telling people, and there's nothing stronger, is there, than
no.
We've got a group, I think we've got about 26,000 people, and new people come and say, I've just been diagnosed with whatever, and has anybody else tried it? And everybody jumps in, yes, I've been taking LDN for this long. And people can ask questions where years ago you were at home without the internet. How do you meet these other people to tell you? So in that respect, it's good. I mean, everything, you shouldn't believe everything you read on the internet, but there are some good tips, hints, and advice, providing you're sensible. And again, this is where, having a compounding pharmacist that you can go and discuss your research with, I think is a good point, a starting point, isn't it?
Yes.
Because there are so many questions, and you're a doctor of pharmacy, and I'm sure you didn't learn that overnight. You're the expert, and the patient can't be expected to know what you know. So people like you are really valuable.
Thank you.
And what would you say to a new patient who has a prescription for LDN? What is the advice that you give them?
I always just let them know, the basic symptoms that they may experience within the first few weeks of taking it, and that many of them will dissipate on their own, but that, we can always alter the time of day or, monitor their side effects. And we work with their prescriber directly as well. So I usually ask them to call us within the first week of starting anything new, whether it's low dose naltrexone or anything else that we would compound or dispense commercially. I always try to increase contact with the patient because it's a way of building a rapport and trust with them. So that's very important. They, whenever they start something that they may not feel comfortable with or not know a lot about, just having, that comfort level of knowing we're there for them makes a big difference. And that goes in line with what we were talking about before this actual recording, is that, having that face-to-face contact and having that rapport with a patient is what makes the difference between a local compounding pharmacist and someone that may be shipping to them, which not to say they can't reach out and call them, but it is nice to put a face to a name and build that rapport. And that definitely has lent itself to that patient that's satisfied with our service sending their friends and family members who may be in the same situation. Mm-hmm. But always when someone gets a new prescription, I don't want to scare anyone, but I go over the most common things that may happen and what they can do if those occur. Mm-hmm. And in this instance, many of it doesn't mean that they have to stop taking it. It's just a matter of tweaking what they're doing.
Mm-hmm. It's building relationships, isn't it? And building trust.
Yes.
And have you found by changing the dose from evening to morning, it is less effective?
Yes, we have seen that in the one person that had the dreams. However, she was able to move it back to an evening regimen over time. Mm-hmm.
Because there are many people now that prefer taking it in the morning than in the evening. They think it works better. I personally have been taking LDN for 14 years, and I have tried taking it at all different times of the day, and it doesn't make any difference to me personally. It doesn't make me feel better at night or better in the morning. It's all the same. So,
good.
Yeah. So that's another thing, because people will say, oh, I'm going abroad, I'm going to Australia or a different time zone. What do I do about taking my LDN? I always take it at 9 o'clock in the evening or 11 o'clock in the evening. I just always take it before bedtime, wherever bedtime is.
Oh, that makes sense, yeah. Mm-hmm.
And it honestly has no ill effects. And when I first started taking LDN over 14 years ago, it was advised to take a 2-day break every 10 days. And now, since 2010, that was done away with that. You should take it all the time. But people worry, last night I fell asleep and I forgot to take my LDN. Is it going to affect me? Well, you can miss the odd dose and you don't have to panic. It doesn't matter, does it?
No.
And you said that 90% of your prescriptions you compound are in capsules. So does that mean you do some liquid?
Yes. I think we had one patient on it, and I'm not sure if we still compound for her, if she has moved out of state. So everyone else currently is on a capsule, is using a capsule.
So if anybody wanted to come to you and have it in a different form, be it a cream or a sublingual or the liquid, you would be happy to do that for them. And if they wanted a different filler in the capsule, that would be okay too, I guess.
Yes.
Okay.
We just always try to go with microcrystalline cellulose as a predominant choice because it's not interfering with anything. No one is allergic to it. It's pretty benign. So if people also have, corn allergies, gluten allergies, what have you, it doesn't matter. It won't interfere.
I interviewed a pharmacist in Australia, and the filler of choice in that pharmacy was rice powder.
Oh, yeah, that's also a good choice.
And
we don't really use that here in the U.S. I don't know why, but
I hadn't heard of it.
Be a good choice.
I'd never heard of it, and I was like, wow. And for the cream, the topical cream, they put in emu oil.
Oh.
Because apparently it absorbs quicker in the skin. So doing these interviews, I'm learning so much from different people around the world. So I thought that was a handy piece of information. So anybody who's in the New York, Manhattan area, I think you said, you could fill their prescriptions. How do they contact you?
We have a website, which is applevalleypharmacy.com. We also have a Facebook page, which is also Facebook, Apple Valley Pharmacy, or via phone. I can give you our number. It's 845-988-5805. And we're readily available to help anyone that needs it.
And what are your opening hours?
Sure. Our store hours are 9 a.m. to 7 p.m., Monday through Friday. Saturdays we're open from 9 a.m. to 1 p.m., and Sundays we're closed.
Okay.
And we ship our prescriptions that are compounded free of charge. So if the person doesn't live in the immediate area, it's not a concern. We would mail it to them for free.
Okay. Well, that's a good service. Well, we're just about run out of time. Is there anything else you'd like to add before we go?
No. It was a pleasure to be on the show. I appreciate it.
Well, thank you very much for being my guest today.
All right. Thank you. Bye-bye.
This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specializing in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.